Hi, my name is Dr. Daniels. I'm a chiropractor with The Joint. We're going to talk a little bit about the sitting posture and how it relates to the lower back. What a lot of people don't understand is there's actually an increased disc pressure along with muscle contraction, more so in the sitting position than standing. So I want you to show you a chart. This is out of Harvard University, and what we're showing you now is a chart of disc pressures. So lying on the back, there's 25 pounds of disc pressure. On the side, and this is disc pressure in the lower lumbar spine, your lower back, on the side it's 75 pounds. Standing up, it's 100. You see that sitting is 140. So there's more disc pressure, muscle contraction in the sitting position than standing. Now when we bend over, that increases the disc pressure, muscle contraction, that increases. But if we slouch at a chair, the muscle contraction actually and disc pressure actually increased. Same thing with a weight, bending over with a weight 220, same weight, sitting, bending over 275. So sitting has more disc pressure than standing. Here's why. This is a replica of the spine. Normal spine, there's a lordosis or a nice curve here in the lower back. This is a patient facing this, not really a patient, but this is a model facing this way. I can lay on my back and I can put my arm underneath because of this curve. In this position, some of the weight is borne on the joints back here, some on the disc. When we bend and go forward, we take the weight off the joints and we start to pinch the disc. Not good for the disc. That's why the car companies came out with the lumbar lordosis in the car. So here's the proper way of sitting. I want to have a lumbar, and this chair does, lordosis, to stick out the curve, and I want to tilt back about 10 degrees. So I'm this way. Do not try to sit straight up, because then invariably you'll end up doing this. As I lean forward, it creates more lower back pain. If you don't have a lumbar support, you can actually just roll up a towel. This one might be a little bit thick, but we're trying to show the joint here, okay? Whoop, sorry. Okay, and you can put that into the back, above the bone here, and then you can just lay back against this. So this one's a little bit thick. You can go to your tolerance, lean back a little bit. Showing you on the model here, that support should go right in here, okay? In all my disc patients with pinched nerves down the leg, we decrease the disc pressure as much as possible. They're not to sit. If they're to sit, lumbar lordosis, leaning back about 10 degrees, that will help your back.